So we are now live. Right. We'll go ahead and get started with public comment. Members, we do have public comment, a few public comments today. Deb Bazan sent out an email this morning with all of the different individuals who will be speaking, and with one written comment from Mark Burton with all the attachments for your review. As far as public comments for people who will be speaking for 1.5 minutes, we have Ralph DePalma, Tina Cashel, and Ilsa Bell, excuse me. So we'll go ahead and start with, let me check the attendees.
Ralph DePalma is not in.
He's not in?
No.
Okay. So Ralph DePalma is not in, but we'll move on to Tina. Looks like Tina is.
Yes.
Do you want to move her in?
Yes. She's left.
All right.
Good
Tina,
morning.
you have 1.5 minutes.
Okay, good morning. Thank you for allowing me time to speak. I'll try to be brief. Many of you know, or some of you may know, that I am a member of the Albuquerque Quaker Meeting, which is near downtown, where we've been serving members of the unsheltered community for quite a long time, but especially since COVID broke out in our community. I have just a few questions, which are, what community centers that are not currently being used as daycare facilities, or what other government spaces could be opened as warming centers as we move into the colder months? We've had 3 extreme weather events in as many months, and we're very concerned that there is not sufficient spaces for people to go to be warm, especially during the day. We know that the West Side Shelter is now open, and that there have been 4 hotels stood up in the last couple of weeks, and we're just concerned that we need more support for people that are on the street. Secondly, what emergency plan does the city have in place for such extreme events, such as extreme weather and the emergence of higher rates of COVID, especially now that we know that COVID is on the street? What plans does the city have to address that spread of COVID? And can we work together to stop clearing people and moving them around, which is actually just increasing the spread of COVID? I see that I'm at my time, and I'll leave it there. Thank you very much.
15 seconds.
I have 15 seconds. Thank you. I think those are my concerns, and thank you very much for your time.
Hold on. Tina, let me just say that we appreciate your taking time to visit with us this morning. We will take each of your questions, and we'll have someone from our Department of Family and Community Services get back in touch with you and give you some general information. In the meantime, as this meeting progresses, we will have our Family and Community Services Director touch a little bit about all of these issues in one of our report outs. So we appreciate you talking to us this morning.
Okay. So who do we have?
Ralph DePalma is still out.
Okay.
We can move on to Ilsa now.
So Ilsa Bell, you will be up next. You'll have 1.5 minutes, and I'll let you know when you have about 15 seconds remaining.
Good morning, everyone. I've got similar concerns to Tina, and it's no secret we also generally frequently work together. I also sent a letter to endorse the idea of sanctioned tent communities to this committee and various other officials recently. With the outbreak and the increase of the outbreak of COVID on the street, it becomes more urgent to actually start looking at these types of alternatives. And I would urge this council to also formulate a comprehensive, but literally a comprehensive emergency plan for specifically the people who live outside and who might not access the shelter. Those people frequently just slip through the cracks and they're forgotten. And then also make this plan available to the public. I think Albuquerque showed in the last blizzard that we can mobilize quite powerfully and help with the provisioning. But then we need to know where to move to. Thank you.
Thank you very much, Elsa, and we appreciate your comments as well and your interest on these issues. Again, we will have a report out throughout this conversation this morning, and also we would be happy to have our department get back in touch with you. In the meantime, Elsa and Tina, if you all have some ideas that you'd like to share with us, we certainly would appreciate you sending your comments via the email that David, can you just make sure that they have that email that we announce it so that people know?
We'll send an email to the chat so all
Okay.
attendees can see it.
Very good. So thank you so much for your time. Anybody else, David?
I do not see Ralph on, so that's it for our public comments. There is the one written comment.
Right.
I haven't received.
And members of the committee, just for information, you do have all the written comments that were transmitted to you as part of the packet with folks, other folks that have sent us written comments and related to the work that we're doing with the committee. So with that, we have one individual that has signed up and has not shown up on the chat yet. So with perfect timing, the mayor has just walked in. So Mayor, here's your stuff.
Sure. Okay, well, I think we're going to get into our discussion items. And just as the folks mentioned in the public comment, a timely update. So I want to begin with Carol and an overview of what's happening at the shelter and with weather and COVID. And she has a giant binder of material to go over. So, but before we do that, we should, of course, approve the minutes. So hopefully everyone had a chance to take a look at those. And let's just check and make sure, any questions on the minutes? All right,
I
seeing
move
none-
to approve
oh,
the minutes.
Thank you.
Sorry about that,
Motion-
Mayor.
No worries. Motion's been made by County Manager Morgus Baca. And is there a second?
I'll second.
Great, Vice Chair, thank you. And we'll just ask if there's any opposition to approving the minutes. Either wave at us frantically or click the hand raise button. All right, the minutes are approved. Okay, so with that, Cheryl, or Carol, I've done that before.
I know, it's Carol though, yeah.
Trust me, I know her name. Channeling Shirley and Stapleton, who's been in touch with us on this issue. All right, go ahead, Carol.
Great, thank you, Mayor. Well, as everyone knows, we're hitting over 1,400 cases in our community and our state daily. And as everyone knows, the WEC has been reopened. We are following all of our COVID safe practices out there. We do have isolation areas. We do have room for people to be at the WEC. It is open 24/7 with hot meals served and to keep people safe. What we have also set up is, as was mentioned, we currently in our community have set up a system of 4 hotels. And with the anticipation of a 5th one coming online with the help of the county that we're very excited about. So with those 4 hotels, 3 of those have been open for months. 2 of those are for COVID positive individuals that need to isolate. And these are people without homes. Sometimes these are people from remote areas around Albuquerque that need to come in for safety. So we have 2 hotels. Those are usually at very high occupancy. The other 2 hotels are for non-COVID individuals, but who are older and are vulnerable. And this is what we've done to reduce the density at the west side. And we have also made our newest hotel, one of those 2 hotels that we refer to as a wellness hotel, is available for families. So we no longer have a family pod out at the west side just to open that for single individuals and the new wellness hotel. But we have big challenges. With the rise of COVID cases, we get a census daily and we are filling to the brim in those locations. I want to add though, the fifth hotel, and we're really grateful, County Manager Morgus Baca, for the potential to go live on Thursday for first responders. And so that's helping reduce the density, because one of our hotels for COVID positive, there was a floor reserved there, and we need to make that floor available for others. So one of our biggest challenges right now in the state is getting the timing on COVID results. So I know we're working with the state. As of report yesterday at 11 a.m., we had tests that were done the end of October, and we still did not have those results. And I'm sure, as everybody can see, that kind of can gum up the system if we don't have the results and we don't know whether people need to be in isolation or not. But our biggest gaps right now is in this system that we have set up with the 4 hotels, with our WEC, with the anticipated hotel coming online with the county, is we do not have a place for people with high medical acuity. So these are folks coming out of hospitals who do not have homes, but they have big medical problems. And our medical staffing at our 2 COVID hotels is not such to manage those problems. I learned yesterday that we work closely with our hospitals, but now somebody was discharged and somehow they got with a family member who then dropped them off at a hotel. There's a very defined system to get into the hotels so we can manage it appropriately, know what the discharge records are from a hospital, so we can care for them carefully. So that's the first gap, people with high medical acuity who have been COVID impacted. Similarly, there are people coming out of the hospital who cannot go home because maybe they live in a home with somebody who's medically fragile, or maybe they live in a congregate setting of some kind. There is not a place for those people in our current system to have a place to be safe from COVID. That's the second gap. The third gap is for people with moderate to severe behavioral health problems or substance abuse problems, such as drug-induced psychosis or severe anxiety attacks. We do not have a place in our system for those folks. Now, I'll say, when I double checked this morning, of the wellness hotel that we set up about 2 to 3 weeks ago, about half of those people are in that category that they probably shouldn't be there. I'm just going to be frank. They have behavioral health challenges, and they really aren't able to comply with the agreement signed to be with that hotel, to be a good guest in that hotel and be responsive. So we don't have the staffing there. So those gaps that we have, high medical acuity, people COVID impacted without homes, people coming out of the hospital who may have a home but don't have a place, and behavioral health or substance abuse, moderate to severe problems, those remain big gaps in our system. And as we all know, with the rise of COVID cases and our hospitals being at the brink, this is a concern with the system that we've got. So I can stand for questions, Mayor, or however you would like to proceed.
Sure. Well, thank you, Carol. And let's take some questions on this. And as a reminder too, we have used community centers in the past for overflow. And so I know there's some questions on that in public comment. Yeah. So we actually have lots of emergency plans around this. But by far and away, if we can do it, the hotels are the best way to do this, right? And just think about it, right? Somebody gets a room and a bathroom, like, instead of a cot. So I just want to emphasize, like, when we can, hotels are always a better option than any kind of shelter or community center. So I'm really grateful for the team for being able to leverage hotels so far. And so we want to save that community center option for literally, like, when we're out of hotels. But yes, questions for Carol.
And maybe while folks are thinking, Mayor, if I could add to that, all of our community centers are currently providing youth programming. So while, as Mayor suggested, we did set up 3 community centers early on with the blessings of city councilors in those districts, and that worked for the 30 to 40 people in those. But as of early summer, all those community centers are working, are providing youth programming. I will say, when we set up the hotel a few weeks ago, we measured the pros and cons of opening a senior center. But that senior center would have only held about 30 folks in the cots, as the mayor mentioned. We needed to rally the staffing, and it was in the community's best interest. And we were grateful that we had a hotel owner to work with us to open the second wellness hotel, which created capacity for 100 people as opposed to the 30.
Question,
Sure.
would the convention center be an option?
So we do have plans on the convention center on how we would do that. Similarly, there are a couple of challenges, right? There's no showers in the convention center. And obviously it's still a cot scenario. So, you know, some of our community centers, like our multi-gen centers, actually do have showers. So the convention center, again, is kind of a path of least resort, and a hotel is much, much better than the convention center for the individuals.
If
Okay,
I may,
thank you.
while people are thinking about questions, I probably didn't emphasize this enough, that part of our challenge is staffing, and County Manager Morgus Baca, we appreciate the conversations we're having with the county on staffing. Right now, because we need a variety of people, we need people with medical expertise, whether that be nurses, EMTs, paramedics, or site managers. We are going through temp agencies to find these folks. We have struggled there to get adequate staffing for any of these sites, whether large or small.
Any update from the county county manager just on any avenues there?
I think, Mr. Mayor, I think that our partnership with the city, I think it just goes a long way working together. Carol, thanks for reaching out to us. I really appreciate that because, you know, we were able to, certainly able to work with you all and, you know, staff the hotel. And so I don't, you know, we're willing to partner with the city however we can. I just think working together is just so much better than trying to do our own separate things, because it's all one community, one Albuquerque, one Bernalillo County. So we're here to help. And then I know that Chief Pettis is evaluating staff that can provide the services. So we'll get back with you in the next couple of days or something. So we'll get this up and running. But we appreciate the meetings, and you know, we had to have some really tough discussions, but we have to step up to the plate and do what's right. So we're certainly here to help.
County Manager Morgus Baca, thank you so much. I think the conversations when we have the state at the table, the county at the table, the city at the table, and UNM has been there, have been not only tough conversations, which we're okay with, but really rich conversations, because we really are all in this together. We're really excited about the potential of the 9 staff that you and Chief Perez have talked about. That will really relieve some pressure as we move forward, or as we make a determination how we'll fill these other gaps together. So thank you.
My eyes are so bad, I can't see at that end of this table. I can't see anyone's name.
Oh,
But I want to give shout outs to Mountain Air for the nice face mask.
All right, so other questions for Cheryl?
Carol. Well,
Commissioner O'Malley, please.
Thank you, Mr. Mayor. Carol, you mentioned that it was difficult to get staff through the agency. So is it, they're just not available? What are the chances there? Is it what people are asking for this position? Could you talk a little more about that?
Thank you, Commissioner O'Malley, for that question. Sometimes it's just having the available piece through the different temp agencies. What we've all done, I put the plea out to my department. If you know somebody who is unemployed, and I want to say roughly, I'll look to team, I think it's $17 an hour in some of these positions, please send me their name. And then we work through the temp agency. We're just not getting a lot of names. I will say also that, yes, this is hours where you're working at least till 9 p.m. at night, depending on who's coming through. We've had people there at midnight at the hotels, and then they're not staffed at our wellness hotels overnight. But we've had people that once they're in the position, they realize this is a vulnerable population. They don't have experience working with this population, and it's not what they feel prepared to do. We've also had to let people go because it wasn't a good fit. I will say a big shout out to Sochi Campos Biggs for providing the trauma-informed care that is recorded for workers to take advantage of that, because we really want all of our care to be trauma informed. So long-winded answer, but some people are just not used to working with a vulnerable population. And as I mentioned, in our wellness hotel, if half of those folks have moderate to severe behavioral health problems, we are not equipped for that.
Thank you.
Thank you, Commissioner. Other questions? Okay, it looks like we were okay on that topic. Carol, anything else?
Mayor, I think I'm good. Thank you.
All right. Okay, let's move on to our next topic for today. We're just very excited about the Crisis Triage Center, and wanted to just provide an update a little bit, as a group. So Manager Baca, if you want to hand it off or do whatever you want to do, we'll hand it over to the county and then UNM for an update on this great project.
Sure thing, Mr. Mayor. So everyone, we are real excited to share our information with you all regarding the Crisis Triage Center. So as everybody knows, that's kind of why we asked for that behavioral health taxes, to provide this kind of service to the community. So now UNMH has graciously offered one of their properties for the Crisis Triage Center. So it will be located at 2600 Marble. It's really in an ideal place because we don't have to worry about zoning, having community meetings. It's right there next to the Adult Psych Center. So that to me has been, that was a huge development. And just to back up a little bit, so as you all may or may not know, the county and UNMH had entered into an agreement, whereas the county would be contributing $20 million one-time capital funding, and UNMH would also be contributing $20 million capital funding towards this project. So because it is in an existing location, we think that is going to serve us very well, and it's going to be a beautiful, beautiful facility. So it's got a courtyard so that people can go outside and kind of take a breather and get outdoors. It's got it's around some really beautiful landscaping and trees, mature landscaping and trees. And so it's just, like I say, we're real excited. It's just kind of like an ideal situation. And as far as operations, we also entered into an agreement where the county would dedicate $10 million in recurring operating funds, and UNMH would dedicate $10 million of operating funds recurring. So, we expect this, we're real excited. We've had several meetings. And the site was actually identified in October of 2020. It will provide a 16-bed stabilization unit. That's a state and regulation, federal regulation only allows for a maximum of 6 clients at one time, as you all probably know that. So there'll be actually 20 beds total. But so just in case it's sort of the numbers flip-flop, like maybe there'll be 12 men, 8 women, or vice versa. So we're just going to make sure that there's just 20 beds total, but 16 is the capacity. I'm sorry. So I said that wrong. So I'm adding up to 16. So it would be like 4 beds and then 12 on the other side, right? So just as long as we get to that, we don't surpass the 16 beds, but there'll be 20 total. So the target population includes adults 18 years of age plus with a mental health diagnosis who do not meet the criteria for psychiatric acute inpatient placement, but need continued stabilization supports, or those who are stepping down from psychiatric acute inpatient support services. So in order to move to a lower level of care, the site will be renovated to meet the needs of both, as I was saying, male and female clients, as well as there'll be some room for administrative support staff as well. So it's like I say, that building is just well suited for what we're wanting to accomplish. So one side can be for the patients, and then the other side can be for all the administrative services that will need to be provided, within the facility. So the Crisis Triage Center services, it will become a part of the crisis and community continuum that has been built over the last 4 years. And so in November of 2020, we expect the architectural assessment of the site that I just talked about. It's supposed to be completed, and it'll provide further insight on construction options on the footprint of this particular site. So pretty exciting news. And, again, that's what happens when you have good partners. And just know that, we're real excited to say that now we finally have a place where people, the APD, Sheriff's Department, Fire Department, city and county can drop people off. There's an option now. So, and instead of people having to go to the emergency rooms, which UNMH and Presbyterian and Lovelace can attest to, and all our hospital, all our emergency rooms, there'll be a place for these people to go to instead of heading towards the emergency room. So just real exciting news. We'll be working together, and there is a connection with the homeless shelter. And I want to make sure that you all know this, and we want to acknowledge that it serves everybody, not just the community or the community at large. It will serve the community at large, but it'll also serve this homeless community. So we'll need to have further discussions on how we get these folks over to this service. And I stand for questions. I know that Margarita's on the line, and so is Rodney McNeese from UNMH. So any questions?
Great. Thanks so much for that update, and very exciting to see some tangible progress on this. I think we've got a couple of questions, so I'll just go to a few of them. And so Carol, go ahead.
Yeah, thank you. Thank you, County Manager, for that background. Just a couple questions, and I think to Rodney and maybe Quinn as well. I know the Services Committee has identified the Crisis Triage Center as a key piece in our community, which you mentioned as well. So I imagine this, with the 16 beds, is a core piece of that, but there will be need for other locations to respond to this need in our community. Can Rodney or County Manager just speak to that demand for the service? And then also, will it address what we're just seeing so much of is drug-induced psychosis? So people coming off of meth, and where we have a good place to put folks not in an emergency room or a jail. So I just love to hear more.
So good morning, everyone. Good morning, Carol. To answer your question, the Crisis Center really will be one part of a whole continuum of care. As Manager Baca discussed a little bit earlier, there's been a lot of work, as you know, with the city and the county and UNM over the last few years to try to actually develop more of a continuum of care in the Albuquerque metro area, and especially with a lot of the programming that's been developed over at the CARE campus by Bernalillo County, a lot of that in conjunction with UNMH. And the Crisis Center really just gives us another tool to be able to help address the needs of the community. There is a stabilization unit that's currently operated over at the CARE campus, and that will continue to operate. And I think those two facilities we envision would be working kind of in tandem, where probably folks with higher medical acuity types of needs would remain at what will be the new CTC at UNM. And then after they become more stabilized, they will probably transition over to the CARE campus. So given the needs in our community, there's got to be several doors and several options for people to access care. And so I think all of those pathways would continue to exist. It's just that this is a new pathway, and hopefully will help to kind of fill an important gap that's currently in the system.
And thank you, Rodney. Drug-induced psychosis. I mean, will those folks that would be eligible?
Yes, and so, sorry, Carol, I left off that piece. So one of the good things about the location of the CSC, which will be located just immediately to the southeast of the existing psychiatric center, and psychiatric emergency services is actually in that same location or in that building. So it's anticipated that folks would transition back and forth depending on their acuity level and what's going on with the patient. We do see a whole bunch of folks currently in PS with meth. That certainly has gotten to be a huge issue in the community. So whether they would be the most appropriate person to stay at the CTC or whether they would need to transition to one of the options depending on their needs, I think that's going to really depend on the individual patient and where they are kind of on that continuum between their medical acuity, their addiction issue, and the psychiatric issue.
And if I may add to that, Mr. Mayor, just echoing what Rodney said, I think it's difficult to say drug-induced psychosis goes here because each patient is unique, and Commissioner Piscotti can speak to this. If there is an imminent need for a detox from a substance because the substance need is the primary, they would probably come to us here at the CARE campus. We currently serve clients addicted to methamphetamine on a daily basis and have regimens for which we work with those clients. If the acute psychosis is a priority, psych emergency may be that first touch, and then from psych emergency they can go to CTC. So I think it's difficult for us to categorize this specific patient under this specific diagnosis or a specific category fits in this one site, because with behavioral health, it's gray, right? It's extremely gray, and then you add a substance, it's even grayer. We currently do this dance, right? Where if a client reports to us with looking to detox from methamphetamine and they're having an acute psychosis that we can't manage because they're above our level of acuity on the CARE campus, we work with psych emergency services to help address that psychiatric component, and then they come back to us for the substance-based need. And so I think, Carol, we know that there are large gaps in the system, but we are currently serving those populations. And I think now that we have CTC as an additional option on the UNM footprint, it'll be yet another resource for that continued support for the clients.
And thank you, Margarita and Rodney. I really appreciate that. I think this is also was acutely on my mind as we were problem solving over the weekend, where to send somebody with psychosis. And I think the medical intake for what were our options over the weekend to avoid the emergency room and not try to gum that up, and just to help me out on that. We ended
So-
up getting 2 people help, but I felt like we were kind of band-aiding it a little bit.
So, and Rodney, you can speak to this better than I can, but the options right now for an acute psychosis is psych emergency, right? So it's not your traditional main emergency room, but is the psychiatric emergency services. And then they can refer to us for continued stabilization or for detox as that trajectory follows through. Rodney, would you add anything to that?
No, I think that's correct. Only that those folks also potentially could be seen over at Caseman through their emergency department because they do have psych services available within the ED at Press. But for those type of patients, those would be in the metro area. Those would be probably the options as far as facilities.
Thank you.
A couple of other just quick ones. We have several folks with questions, but I just want to check. Did you say 60 beds?
So go ahead, Julie. I'm sorry.
That's okay. 16.
16 beds. Okay.
Yeah, 16.
Okay. So just checking on the kind of supply and demand, so this will help, but I mean, I think we have several studies where like in need of 200 or so. Am I getting that right?
On
the demand
Yeah.
for the services, the number
It's-
of beds we need in Albuquerque?
So what I can speak to is specifically the state and federal regulations. So federal regulations, Institute for Mental Disease Regulations requires a maximum of 16 beds, a maximum of 16 clients in a unit in a crisis triage center at one given time. That is federal regulation, and it is echoed by the state CTC licensure regs. And so to your point, Mr. Mayor, 16 beds does not solve the whole problem, right? I think this is something why we've built the crisis stabilization on the CARES campus, which is 16 beds, the crisis stabilization or the crisis triage center on the UNM footprint, which is 16 beds, and multiple will be needed. And we encourage other providers to launch CTCs in their respective jurisdictions and respective entities to help meet the larger demand. I think what we're hearing on the demand for psychiatric services is not always necessarily CTC beds, but it's an expansion of psychiatric services. So we hear about the increased need for psychiatric inpatient beds, the accessibility for increased children's psychiatric beds, increased demand, and what we're even hearing as a part of the analysis with UNM on increased demand for geriatric services on the behavioral health spectrum, and as well as, again, the outpatient services. So as Rodney mentioned, this is part of a continuum. So the CTC is one piece of the larger continuum that's needing to be fleshed out.
Buzzword bingo, we've said continuum at least 12 times, so I get the continuum point.
Yeah, no, and
Go
no,
ahead.
and that's important. And I appreciate this discussion so much because there's got to be multiple entry points, and 16 is driven by federal regulation. And I think what the services committee we need to talk about more is then what, right? I mean, that's what we're up against, is where people will get treatment then. I mean, stabilization is so important, and I'm excited to have another entry point, many. And then what? For us as a community, the treatment options that we've all got to come together, city, county, UNM, then what? Because we've got to have multiple entry points and I appreciate, Margarita, you're reminding me, I mean, behavioral health is such a broad area and different people have different needs. But I think as we move forward to address these gaps, there are going to need to be hundreds of beds for whatever that pathway is into treatment when somebody's ready or whatever that may be. And so I think as the services committee continues to move forward in our conversations, it'll be so important that we keep fleshing this out. But it's exciting to have new entry points. And then what?
Good to do item for that committee. And just to check the 24/7 drop off, and does that require, so it is at APD, they can just show up, or is it a call through dispatch? And then if there's 16 beds and they're obviously if they're full, then they're full. But what is the early thoughts on protocol for that 24/7 drop off? Or is it 24/7?
So we're really early in that conversation, and it is again part of the dialogue that the team between UNM and the county is working to flush through. Being again that we're co-located with psych emergency services, there's an opportunity for us to have a drop-off triage points where we could say this person is appropriate for CTC, this person is appropriate for psych emergency, or how we connect the persons correctly. As the manager mentioned, there is a architectural assessment that's going on right now, and there is again going to be a discussion in the renovations of a specific drop-off site. We absolutely don't want this to become just a dump location, right? So there will also absolutely be protocols in place and dialogue in place so that all first responders are clear on appropriate referrals and how we navigate that. Because while this is a venue for us to create a no wrong door, on one location, right? So if somebody needs psych emergency, we can get them there. If somebody needs CTC, we can get them there. We want to make sure that we're still connecting clients to the right place. If they're more appropriate for coming to the CARES campus, we want them to come here instead of CTC. So having some robust conversations and training with all first responders so that there's clarity on what patients go where and when.
Okay, and I think this did come out in the overview, but what's the timing forecast for when we might be up and running? I know it's going to be a long time, but you know.
Mr. Mayor, I can speak a bit to that. We're kind of at the beginning point of that timeline, and at this point, we don't know, I think, what that is going to exactly look like because there's several variables. Right now, as Margarita mentioned, we're at the point of we're working on an RFP to put out related to an architectural piece to give us enough detail to actually get all of the approvals in place that have got to be put in place also through the UNM system. So in order to do that, we've got to have a more refined kind of program plan and an order of magnitude on the financial pieces. So that work to get that information is started, and then with Dr. Richards and President Stokes' help, we'll have to kind of navigate through the UNM approval channels. And once we actually engage an architect and the construction period on a project of this size, my guess is once you actually start the construction, you're probably talking somewhere around 18 months. However, I would caution, we have experienced some delay because of COVID with some of the other kind of construction work we're doing. So right now, that also kind of creates a bit of a wild card related to the construction timeline. So we're not sure, but we are at least on the road and starting the journey to try to get where we need to go with this.
Very good. Just like order of magnitude, not sooner than a year, not sooner than a month. I mean, like 1 to 3 years, 2 to 10 years. What are we talking about here?
I think it's safe to say, Mr. Mayor, it would not be within 12 months. I think the more likely time horizon is probably 2 to 2.5 years kind of time frame, depending on how all those variables kind of fit together for a project of this size.
Okay, great. And then one more that we had was just the 10 million. I think I heard a 10 million number. Was that construction or operating, or what was? And I know it's all early estimates, or did I just mishear that?
Mr. Mayor, it's operating.
Okay, 10 million to operate. Wow. Wow, 16 beds, 10 million. That's
so. If I can chime back on that piece, it is up to. And it is the 10 million is a one-time allocation. So it's a total of a $30 million appropriation was what was approved, 20 million for capital, and then a 10 million component. So it is a 30 million one time just from the county.
Let me just check. I don't know, President Stokes, did you want to chime in on that, or
I'll need to seek some clarification on that, because I would always assume operating dollars were were annual and recurring.
Right.
They don't operate if they're not.
Right, and I think we can flesh that out further, and Rodney can chime in on this. And that is again a larger part of the conversation, and it is for the continuum, right? It's not specifically just operation of the CTC; it's for that continuum.
Well,
And Mr. Mayor and President Stokes, I did want to tell you, so I did say up to 10 million recurring operating, but I think initially we'll probably need some serious operating money from both ends. And it probably won't be, like 20 million, but up to that point. And yeah, to your point, President Stokes, yeah, we do need operating money. So I think that there's a commitment from both entities for recurring operating money. So want to make that really clear. We have to have it.
Well, and President Stokes, to clarify a little bit, I think the financial assumptions with this are the recurring operating funding would come from probably a few different sources. A large part of it would actually be through the clinical delivery system and through third-party revenue, Medicaid, Medicare, those kinds of billings that, are part of our kind of normal operations of the hospital. And then it is anticipated with some of the other funding streams we have, especially at the start and to managers and Margarita's point, some of that 10 million may need to be used to kind of help kickstart the program for that first year or so. But we do anticipate once this is up and going that the model certainly would be financially sustainable from a revenue perspective.
Really appreciate those comments. Thank you.
Okay, there's lots of questions coming in, so I'll go just in no particular order with Commissioner O'Malley. Go ahead.
Thank you, Mr. Mayor. I just wanted to follow up on Carol's point about, so I'll just talk a little bit what happened when we were hearing testimony as we were considering moving forward with the tax, which was of course several years ago. And I always remember a mother in particular who was with her son. She brought her son with her, who was exhibiting some issues, behavioral issues. And she had said that it was very, very difficult. And I heard from a couple of mothers, they, first of all, didn't have any place to take their sons, that if they went to the hospital, then they should have got treatment, but then they were released. And the other thing was, after stabilization, if they couldn't stable, they were concerned about them coming home. And it was just stressful. So I guess to your, and I haven't really delved into this, but to the question as so what would we be doing for these people? And I guess Rodney, if you could answer that, that would be great.
So Commissioner, I think the population that would primarily, I think we're envisioning this would target are a couple of groups. Right now, it's really the group below the level of meeting the clinical criteria for an acute psychiatric hospital admission. So I know one of the significant frustrations we hear is folks feel like a loved one or a neighbor should be admitted to the hospital, but at the end of the day, the criteria to actually be on an inpatient psych hospital unit is actually pretty high as far as the acuity level. So this would help to provide a level kind of below that, and it would also help to serve as a pathway for people coming out of inpatient care potentially that need more than just episodic outpatient care. So that's kind of one of those populations. The other, I think, significant group would be folks that are presenting to the crisis center who do need some time, and we're anticipating, in addition to the medical resources, there's significant kind of social service support that's going to be required. So like case coordination, assistance with housing, food assistance, all those kinds of things would be available. So part of it is meeting the social service needs. And then how those folks using those care coordination resources would get connected into the broader system of care. So our goal would be that it's not after 14 days or which is actually the longest somebody can stay in a CTC by the regulation, but after their care is done at the CTC and they're ready to step down, our hope would be that by having this kind of mechanism, we could do a better job of actually keeping those folks connected to the care system through some mechanism. And at UNM, one of the other things we have developed over the last about a year and a half now is what we call CareLink, which is actually a medical home for very high needs behavioral health people that has been developed in coordination with the state. And we actually, in adult now, we have somewhere around 1,000 folks that are actually in that. So that provides kind of that ongoing support for very high needs folks. And I think part of this would be how do we do a much better job at trying to manage those populations?
I appreciate that. And that, of course, was one of the biggest concerns that we would hear from, I would just say, families of individuals who, usually, unfortunately, a lot of things well with these individuals. They didn't feel like they were getting enough support beyond, maybe medication, their, family. And then they felt that they couldn't, there was no place for them to go. And in, any length of time, sort of like give the family a real break and or, so they had some real concern about family coming back, to be honest with you. And I'm sure that you've encountered those kinds of situations before. What we were hoping to do, of course, was to deal with that particular issue, in particular with the triage center. Thank you.
Thank you, Commissioner. And let's see, Councilor Benton.
Thank you, Mayor. Not sure, I guess the construction work is design and construction work is being managed by UNM. Did I understand that correctly? So I guess that's who the question would go to. Understand the complexity of the project, but when I hear 2.5 years, my heart kind of sinks. And I'm very well aware of the supply chain issues in the construction industry and so forth. Just a suggestion with regard to the architecture and planning team, they should be in a position to really start to sort out those anticipated challenges early on in the design process. And as a design evolves, they'll get to a point where they could really perhaps be helpful with anticipating those challenges in advance of receiving bids and subcontractor bids and contractor bids. And then related to that, I wanted to ask about UNM's ability or flexibility with regard to architectural and construction delivery systems. Are you able to do a design build process as opposed to a design bid build? Because I think that would really be helpful in these times, especially if there's any flexibility along those lines to get a design build team as opposed to the traditional design bid build where you bid it out.
Dr. Richards, are you able to answer that question? Oops.
So thank you very much for that recommendation on. So I was saying thank you for that suggestion. I believe that may be an option, and we'll take this back to our executive team as a recommendation and consideration.
Yeah, just I think it's worth looking into. I know that the state is doing it in a limited sense, but given the times that we're facing with construction and controlling schedules and cost. Something of this importance and complexity might really be well worth it. Thanks, Mayor.
Julie. Councilor Benton, I just wanted to let you know that I agree with you. Our Alvarado Square building, our county administrative building, we did just that, and it works beautifully. So just so you know, and if y'all have any questions on that, please let us know.
Yeah, particularly, you know, on that supply chain, those kind of issues that affect change orders and delays. You know, you're pushing more responsibility under that team to figure that out. Thanks, Mr. Mayor.
We do have some, of course, other items on the agenda that we do want to get to. It looks like I don't see any hands up on this. I know lots of discussion, and maybe we can have some regular updates from time to time from the teams working on this. And, you know, a couple of broad takeaways. Obviously, it's expensive, which just is to highlight these kinds of services, you know, are cost intensive. It's one reason, just one, why we don't have more of them. You know, two, you know, with the city is, we have waived every fee and used every emergency power possible to help construction. So to the extent there's something specific on this, you shouldn't be waiting on anything from our planning department. So you can shave that off. And if you know, whatever procurement method you want to use, but I mean, we don't even, the whole bid process and all of that is at least under emergency orders subject to change. Now, obviously that's UNM and county have their own rules on that, but those are just some ways to accelerate some projects. And lastly, you know, this is very good news about the 16 beds. Obviously, you know, we need several hundred. So, you know, it's a long road. Okay, which speaks to a lot of the work, of course, the other committees are doing and some of the facilities updates we had last time. Let's do this. I think we should probably move on with some of our other agenda items. And I do want to touch on, we might not have time for full committee updates. So what we'll do is probably save that at the end and hit on at least some of the, they're quite quick, but some items that we do need to touch on. And why don't we start with the community and neighborhood outreach and framework. So whichever committee, I think, or Alicia might be doing that. Alicia, go ahead.
Hey, thanks everyone. I won't take too much time. I just wanted to give a brief update as to what we're doing with garnering community input based on the framework document that this committee put together. So we have created a survey that will be in SurveyMonkey that we can include on our website. And at that point, we'll be able to push that out via our different networks, social media, also our e-newsletter. And so that's kind of where we're at. We've had a lot of success with our SurveyMonkey and in the past with different surveys. So we're hopeful that we'll get a lot of responses this time as well. And as soon as we post that, we're hoping for Thursday. We hope that we can then push that out via your networks as well. And if we get it out on Thursday, that would mean we would send it out in our e-newsletter that we just started through FCS. And then we would also post on social media. So essentially we'll post the framework document on the city's website and then have the survey attached to it so we can get input on it.
Great, thank you, Alicia. And I know subsequent to that too, we'll, you know, try and have, you know, there'll be different sort of Zoom avenues and stuff for subgroups and things like this. But this will be the first sort of broad net. So with that, questions on that process? And of course, this does include the framework. So Carol, do you just want to mention that too?
Well, as Alicia said, what's great about this SurveyMonkey, there's a link there with the framework that everybody's worked hard on. And this is exactly what the committees are now doing. They're taking this the next steps to prioritize, to get operating budgets, and to identify lead agencies.
Okay. All right, questions on that? Okay. Let's move on just as an update, a couple of logistical items. Just, I know there's been a desire to present ABC, GCD, and you know, there's other commissioners and counselors who would like to get an update. And so we think it's a great idea to present to that group. Carol, do you want to outline kind of the game plan?
Yes, I'm set to present, but I would like, in the spirit of the HCC, to invite a UNM person and a county person to co-present with me. I did present to City Council a week ago Monday with a PowerPoint, but I think it would be more effective given the strength of this HCC is that we stand together. So I would just invite who would like to join me, Mayor. That's what I'd like to know.
Yes, that would be great. So let's have a representative from each if we can. And then so I'm not on this committee, so I want to respect the agenda of the chairperson who puts it together, but I might suggest offering an update on the Crisis Triage Center to ABC GCD, just like we had today too. Okay.
Are there any quick volunteers?
Questions and volunteers to present with Carol.
It'd be fun.
So Ike and Pat, are you on ABC GCD? That would just make it even easier just to ask council.
I'm not.
So.
And they're cities, so.
Yeah, okay, well,
Yeah.
we got covered on the city. So
Yeah.
county, I don't know, Commissioner O'Malley or Piscotti. And Commissioner Piscotti, this might be a good vice chair duty.
Yeah, I'm on the ABCGC.
Perfect.
And I'd love to wrangle Margarita into co-presenting.
Done. Okay.
Thanks,
All right.
Commissioner.
And UNM, Dr. Richards, President, anyone?
So Mayor, if you could give us some time, we could follow up with a appropriate UNM representative.
Okay.
Thank you. I couldn't get the button unmuted fast enough. Sorry.
Sure, sounds good. And it's November 19th at 5 p.m. for your planning. And that's a split. It has commissioners and councilors on it. Okay. All right, let's see. So with our time left here, let's do, if we can, a quick round robin for our committee chairs. And so again, we'll just kind of watch the clock, but we'll try and squeeze these in here before we talk about going forward. So facilities, you want to go first or?
Okay. Sure, Mayor.
Okay.
So our facilities committee met on Friday of this past week. We did some additional work on basically on Councilor Benton's suggestions to add a little more meat on our framework as it relates to facilities, looking at ensuring that we have stronger coordination with all our providers, that we look at the impacts with neighborhoods, that we take a real close look at the impacts of these facilities to the communities, and then also that we continue to work on alternatives, if you will, to not just to maybe shelter spaces, but also potentially looking at other encampments, maybe conversations, et cetera, as we move forward. So that committee made those minor changes to the framework, which will be incorporated into the overall framework that Alicia will utilize as it goes out to the community for their input as well. Additionally, just to give everyone an update, we are still in the process of doing the environmental review for the Gibson facility. And that will take some time yet to get that completed, to ensure that we can have a better understanding of the site. The university, through Tom Neal's group, and our folks here at Family and Community Services, Doug Chaplin, continue to work on the review of the facilities at Gibson, looking at the operational systems, et cetera, the mechanical systems, and beginning to put together a framework that would give us a sense of the capacity of the facilities out there as we move closer to making a decision about that facility or that area. And then we continue to do some work with on the north, if you will, Lomas area, to look at continuing to work on looking for sites that might be available, doing some appraisals on some properties, et cetera. We're almost at a point where we can have that conversation at the facilities committee and then bring it up to the full council. And with that, Mayor, that's basically what we've done over the last couple of days.
Very good, thank you. Any questions on facilities? Boy, this mountain air face mask really muffles me. It's a powerful mask. Questions? Looking good. Okay, next committee.
Services, I think.
Services. Quinn, is okay?
Yes.
Hello, everybody. So services we're moving forward as requested. We have not had a meeting since the last HCC meeting. We postponed our last meeting due to the election. So we'll be getting back in the saddle, as they say, on Tuesday. It's really timely because all of the GAPS conversations that keep coming up are really just highlighting our work further. We are hearing a big need for substance use to enhance the continuum. It really is true. What Julie Morgesbaca and Margarita are saying is that it is a continuum. It is a small piece of the puzzle that we're trying to build out. So, substance use in terms of detox, medical step down for adults and young people. And when I say young people, I mean 14 to 18. You'd be surprised at how many in that age range are addicted to opiates. Also, this true need for behavioral health crisis triage, which this is a great addition to our community through UNMH and the county. And also, if you listen to what Carol said in the beginning of our meeting, with the people coming into hotels, we are seeing even a higher need, that the capacity, we can't handle it even at those sites. So just continuing more of that conversation, thinking about how can we continue to build that up. It's also seen in one of the public comments that the intense behavioral health needs in addition to drug-induced psychosis are something that seems to be becoming pervasive. And also the need for medical respite is really strong, as Carol mentioned too. And then so when talking about the continuum and enhancing it, thinking about this partnership that's happening with the county and UNM and like the aftercare connection for the continuum, what happened next? That's something that the services committee can definitely begin to dive into as well. Like where will they go? How can we continue to support them? So I'm looking forward to our next committee, and that's all from Quinn.
Okay, any questions on that? Thank you, Quinn. Excellent. Let's go to our next committee, which is
let's do outreach.
okay. Thanks. And we have, I know, Commissioner Colley on and Sochi.
Hello. Let's see. Where is Commissioner Colley? All right.
There I am.
There is my chair. So I will give just kind of a quick update on some of the items that we're moving, and then turn it over to Commissioner Colley for any elaboration on those pieces. We provided in this document our high-level strategies. There were 4 of them. We've been working hard to just chip away at them and develop them into the ways that appear they need to be, so that I do think that we're actually making some really terrific progress. We identified the need, the group identified the need for a coordinator who, in our conversations, it's been either like a person or potentially a team, just as far as to meet the needs of what the of our providers, and just constantly keeping them together and making sure that the hard work that we're doing and the conversations that we're having continue to happen. So in our last meeting, we did, and actually now that I'm thinking about it, I'm not sure if Denise Lynn is on here too. Sorry, tangent. But just wanted to, but yes, we do want to make sure that the work that we're doing continues, that items, high-level strategies like the coordinated street outreach agreement continue to be revisited and revised, because that has also been a need that's been identified. We're not going to only ever have one approach to coordinated street outreach. If COVID has taught us anything, it's that there is a need to constantly adapt, that the landscape, the very landscape that we work with, the services that are offered changes. And so, so from the group, we've determined that that is something that needs to be updated every 6 months. So that is a high level strategy that we're working on, that the group is working on together. Again, in this last meeting, we did focus on the job description of the coordinator and / coordinating team. Some of the agreements that have come from that is that it's not something that would it would not live within the county or the city. It would be its own entity, whether it lives with a certain organization, provider. That has not been determined, but we've had a lot of really great input from our group members. Again, I just can't highlight enough the cohesion that exists between this particular, well, I don't know about the other committees, but our committee is very cohesive. They work together already. And a big thing that what we're doing right now is because they are so resourceful, because they have so many strategies that they implement already, how can we incorporate some of the work that they're already doing into the high level strategies that we are bringing to this council? So that's, and so I'm going to turn it over to Commissioner Colley.
Thank you, Sochi, and thank you, Mr. Mayor. Just to expand on what Sochi was saying, one of the things that's really clear when you start talking about outreach programs is that you're really talking about outreach people, and that what's so critical in this area more than others is the relationships that persist. Much of the information, much of the assistance, much of the advice, much of the mentoring happens not because we have a job description for a coordinator, but because we have excellent relationships among the people. And one of the things we don't want to lose going forward is the way in which those relationships knit together and serve the whole. So when we start talking about a relation or a description of coordination, we're really talking about the ways in which we continue to promote the relationships of the people who do the work on the street with our clients on the street. And that's very different than a structured system of work. So this is kind of different from the others. I appreciate the time. I love to see the work moving ahead. Thank you all for what you do.
Thank you so much, Commissioner. Okay, I think what we're going to do, we have two other committees, of course, youth and housing, but I don't think they have anything sort of urgent to mention. So we'll start with their updates next time. And a little bit about going forward. We do have a meeting scheduled Tuesday, the 24th. And so I want to continue to keep that on the calendar and expect it to happen, but also let folks know either because of COVID or Thanksgiving, we'll let folks know, obviously, with the 3 days notice. So assume it's happening, but there's a 50-50 chance we may just postpone it based on availability of members and whatnot. So we'll make that call mid next week. Okay, so I think with that, look, we are right at time. Great discussion today. Appreciate everyone's input, and we'll see you soon.
Looks like Margaret's.
And Julie, did you want to add anything, or were you just waiting by?
Well, actually, Mr. Mayor, I did. And I just wanted to make sure, because I think we all got, I think I may have misspoke and I didn't mean to, but I think it didn't come out right. So as far as operating for the CTC, so there's nothing that has been committed from the county or UNMH, but it's up to, we've talked about up to 10 million for services between both entities. So there's nothing in writing. So the 20 million is for the one-time infrastructure and then capital outlay. And then the 10 million is for what we think could be recurring, up to 10 million. So I just wanted to make sure that everybody was clear on that, because that's what I could tell President Stokes. I don't think she's going to talk to me anymore after that. So I
I don't think the mayor's going to talk to us either.
So sorry about that. I apologize.
No worries.
But yes, recurring money. We do need recurring money.
Thank you, Julie.
Sure.
You're great to work with.
Appreciate it, everybody. All right, well, stay safe and healthy, and we'll talk to everyone soon. Thank you again.